My name is Michael Madigan.
My name is Annette Brandel.
So my name is Tully Warren.
Diagnosed with bladder cancer in 2016.
I had a planned surgery that was a knee arthroscopy.
We went to the hospital for Tristan's birth.
You know, when you get diagnosed with cancer, you lie in bed at night and you wonder, well, how much time are they going to be able to beat this? Did they catch it early enough?
The physician that I chose had a surgical center that he used. The facility was not listed in there for me to select.
The day before we were scheduled to go, my wife had just a slight fever, 99.5, I think is what it was.
And so I got customer service on the line, and she said, let's take a look and see if we can get this added into the selection.
Oh, God. I still remember sitting in my urologist's office.
We went in, got our testing, and thought it'd come back fairly quick. Ended up having to get split at right after the birth. So my wife's in one room, my child and I are in the next room. 28 hours later, we finally get a reunion.
I was a little bit nervous with that at first because I thought, here I am going through this process. I know who I want my surgeon to be, and mine didn't have them listed on there. But she reassured me that she was going to be able to take a look at this and follow up with me.
And all the blood work was coming good. The chest x-rays were clean. At about 3.5 years, I can confidently say that I think that you beat this. And you just kind of go, wow. Sorry, I get a little bit emotional when I talk about it, but
being with Bind has changed my approach to my personal health care by freeing me up to focus on my care as opposed to the finances of my care.
For me, there was no anxiety related to medical costs or worries about how much extra COVID testing was going to be, or are we going to have to pay for 2 separate rooms since we're in 2 separate places? None of that really came up with it.
It's a feeling that I don't know if you can describe, because you just feel like you got a second chance at life.
The skepticism, the skepticism that was there, it just seemed too good to be true.
I like to know my care plan and my physicians and my providers, and Bind allows me the option of choosing who I prefer to get care from.
Just being able to look something up on my phone, know the price going into it, we can have it all paid for by the time it actually rolls around because we know generally what it's going to be.
One of the things I didn't have in my first diagnosis was the peace of mind that Bind offers me. Knowing exactly what I was going to pay for every procedure that I had done would have been something I would have greatly wanted back when I was first diagnosed. Now I have that. And I can honestly tell you that you're going to know exactly what you're going to pay throughout any procedure that you're going to have. And it allows me to get my checkups done, and I know exactly what I'm going to pay. And it gives me that peace of mind so I can focus on getting back to good health.
That's so funny that you can see her. You're a monkey. You are a monkey.
Hey guys, I know we've been talking a lot about Tristan, so I thought you guys might want to meet him.